to talk about Summit Pacific Medical Center and what we're doing towards population health and our audacious vision of making our community the healthiest in the nation. Part of that is our 2023 Community Education Series. This is designed by Dr. Cindy Beck. And really, this year, we want to focus in on navigating the healthcare system. We understand that sometimes it can be quite complex and quite challenging, even for people who are in healthcare, and much more difficult for those who aren't. So this year, we're going to have topics such as health insurance, understanding Medicare, Medicaid, what's eligibility and benefits associated with it, how you can be heard better by your healthcare provider and your healthcare team. Talk about somewhat more about women's health from puberty all the way to menopause. And then more complex subjects such as ombudsman and other things, and healthcare facilities. So these talks will be aired every second Tuesday of the month at 5:30. Always be aware of our Facebook page. They'll talk about the series, as well as many, many, many more exciting events we have planned for you. So please check us out on Facebook. In the meantime, let's talk a little bit more about population health. So today we want to focus on a few different topics. The first is developing an understanding of why we believe in this country we need to alter how we provide healthcare. How can we make things better for you as well as others? Talk a little bit about population health, what it is, what the definition is. It's a way to create the healthiest community in the nation. We're going to learn what Summit Pacific is doing to create the healthiest community in the nation. We've already done a lot of work, and we have further work planned, including innovation. So we'll talk about how we're going to use data, programs, other such things along our journey. And then finally, it is a new year. So let's talk about some tips on how to keep yourself and your loved ones well going into 2023. So why do we believe there are challenges in the healthcare system? The first is to spend. The United States spends more money on healthcare than any other nation in the world. In fact, we spent $4.3 trillion on healthcare in 2021. That's almost $13,000 per person. And if you look to the right of this slide, you'll see that the United States per capita, and this is 2019 data, so a little old, but we're still up on that top of the list, spends more money by far than any other nation in the world per person. In fact, that's 18.3% of our gross domestic product. So basically, of every dollar spent in the United States, 18.3 cents of it goes to healthcare. If you want to put a comparison to that, think about military spending. Obviously, our country spends a lot on the military as well. We spent $800 billion on the military in 2021. So only a fifth of it compared to what we spent on healthcare. So we spend a lot of money on healthcare in the United States. Well, what does that money get us? So look at this list, and this is from 2018, although this hasn't changed significantly. And if you look at the top 20 countries by life expectancy, where do we fall on that? Where do we land in terms of life expectancy? Unfortunately, we don't land on that list at all. So in the United States, despite spending almost $13,000 a year per person on healthcare, we're not even in the top 20 of the world for life expectancy. In fact, every single one of those countries, people live over 80 years. And we in the United States in 2018, our average life expectancy was 78.6 years. And in 2021, with the pandemic, that unfortunately dropped to 76.4 years. So people aren't living as long. Well, let's look at some other health outcomes. Well, this is from the Commonwealth Fund. The reality is, though, you could look at a lot of different rating systems. And unfortunately, the United States does not fall on the top of the list, in particular compared to other industrial nations. And so if you look here, highest system performance, we're not there compared to 10 other countries that I think most of us would recognize. And then if you look at spend, though, we spend significantly a higher percentage of our gross domestic product. This Commonwealth Fund looked at several different types of healthcare comparisons. Some of them we did reasonably well in, like preventative measures, safe and coordinated care. U.S. does pretty well in. But if you look at health outcomes, including life expectancy, If you look at access to care, there are some people in the United States who are blessed, and many of us, with good access to care, but others, depending on where you live in the country, as well as if and what type of insurances, you can't get the same quality of care. The other component they looked at was administrative efficiency. And unfortunately, the United States spends a large percentage, and estimates are well into the 10, 20% plus range of money that goes to healthcare is in administrative overhead. Now, every system is going to have some administrative overhead, but ours is one of the largest in the world. So what's the problem? There's several things that we believe, and I believe, that specifically contribute to us not getting the value that we need. So currently we're in a fee-for-service model. And that means as a provider, if I do more procedures, more surgeries, see people more frequently, then I am compensated at a higher level. It's not just providers, it's health systems as well. So we need to begin to switch that from service, not just doing more, but instead creating more value. How are we creating people healthier? How are we going to avoid expensive procedures so you never need that surgery? Not saying that people don't necessarily need surgeries, which of course they do need surgeries, but how can we prevent some of those? Talked about the large administrative overhead already. And then in particular, we spend a lot of money in the last 6 months of life. I've seen numbers that up to 50% of spend is in the last 6 months of life. That's always going to be the most expensive component of hospital care. But I know, and I think many of us have had people who unfortunately have passed away. And then in retrospect, either before they die, they say, or maybe their family says, wow, they really wouldn't want that level of care. We want to provide the best level of care, but we also don't waste care. And in particular, give people procedures, other such things that they may never have wanted anyways. We spend less on keeping people well and more on sick. And then also we have a lack of investment in resources to keep people thriving at home. So maybe I have good insurance, but it doesn't cover for grab bars in the shower and I fall. Well, the insurance pays for me to have my hip fixed after a hip fracture, but it never paid for those grab bars that might have prevented that to begin with, which number one, I'd rather not have that fracture. But then two, of course, it's actually much less expensive to pay for grab bars to prevent me from falling than to pay for that hip surgery. So we believe that population health is going to make the difference. So here's a definition. I'm going to go through it slowly and describe things, and I have some other slides as well. So population health uses knowledge, and that includes demographics, health outcomes, social determinants of health. So I'll talk about that a little bit more. And then culture of a defined region. And culture is really a key component of this because based on people's beliefs, their desires for different types of care, it is really community focused. And then we use that knowledge to design infrastructure, attain resources, and create programs. So based on the community, what those health parameters are, we're designing programs, protocols to promote health wellness, to improve both obviously individual health. You cannot forget about that. Population health doesn't forget the fact that we are all individuals. I may be in a community, but I may be very different in my beliefs and my desires for healthcare. So it doesn't lose that focus, but then it also focuses on the community as a whole, because I could do more by investing on the biggest needs of the community. So let's talk more about social determinants of health. And if you think about it, it's not just our genetics. It's not just if we have diabetes or things to that extent that influences our health. There's a lot of other things as well. For instance, economic status of a community. So the income of what people make versus the cost of living is incredibly important when it comes to health, as you can imagine. It allows health resources and investments, unemployment, job insecurity, and then affordable housing. Education. What we know is obviously people who have a higher level of education, of course, make more money, which helps with the economic status. But then in particular, it also helps with what we call health literacy. Do I understand what my provider is trying to do so that way I could better take care of my heart condition, lung condition, or whatever it may be. Life conditions in the environment are really, really critical as well. Does my neighborhood have, for instance, sidewalks? Make it safer for me to be able to walk if I want to develop a walking program? Are there parks and places where I could take my kids so that way they could begin to develop healthy attitudes, healthy lifestyle early on life? And there are many other such things. Food insecurity. Some people actually describe food as medicine. And there are actually what we're called food deserts, unfortunately, throughout the United States, where people don't have access to healthy fruits, vegetables, other foods that are really going to help with their diabetes, obesity, or whatever it may be. We know that early childhood development programs are essential for health. They not only promote education, but activity, and just provide a benefit for children to thrive. Social inclusion, non-discrimination. Is everybody treated equally in the community? And then obviously, what type of health services are available? So is there good access? Are they affordable? And then, of course, what is the quality of care that you will receive? So at Summit Pacific, we also want to understand community health factors. So medical demographics. So each community has different demographics. It's based on a lot of different things. Percentage of people who smoke, percentage of people who have diabetes, genetic predispositions. So if you're going to design a community health program, a population health program, you understand what are the biggest risk factors of the community. For instance, if I'm in a predominantly African-American community, I may want to focus on specific considerations and diagnoses that are more prevalent in that population. If I'm versus maybe I'm in a very Northern European population, and they have different conditions based just simply on genetics predisposition. Not undermining in the individual person, but it's just the genetics of what conditions I'm more likely to acquire. Lifestyle predispositions are also very community prevalent. Tobacco use, for instance. If families and friends smoke, you're much more likely to smoke. Same holds true for drug and alcohol as well. But even activity levels, meaning children who are raised by families who are active are more likely to continue that pattern, those habits throughout their life. And then finally, it also includes nutritional choices. When we go to that church potluck, which I happen to love to go to, are there healthy choices for me? Or is everyone bringing in donuts and things like that? I'm not saying that you can't ever enjoy a donut, but overall, are the choices wiser when it comes to nutritional benefit? And then medical beliefs are very community influenced. We saw that with COVID-19. What is the confidence in the community for the medical system? What are beliefs about vaccinations, other preventive measures, end of life discussions? A lot of that is community influenced. So once again, population health, though, doesn't end just into the community because we're each individuals trying to fit into this greater community. And so each individual, we have to honor their past experiences. Have they had a loved one who may have died in a skilled nursing facility? So, that's not what I want for myself. What are my individual preferences? What are my individual genetics? I may live in a specific community where there's a high risk for multiple sclerosis, but based on my genetics, I might be much less at risk. What are my personal lifestyle decisions that I have made, maybe outside of genetics and family? And then finally, ultimately, we all want to be respected, and we all want to develop trust in our healthcare providers. And so part of population health is to really treat us as individuals where we look at the health of the community in total. So once again, a good population health program will connect individuals, right, and educate them as a community as a whole. Invest in community wellness programs. And then, Summit Pacific, we have done a lot of that. If you even look at our wellness center and the campus around the wellness center, which promotes children playing, people walking, people jogging, doing other fitness activities. Good program uses data, and I'll talk a lot more about that later, because we want to understand what is going to add the most value to the community when it comes to their health, using data to do so. You want to educate people then about their individual health concerns, and then obviously inform the individual of health programs that are available based on the whole community needs and putting people where they'll be best served. So Summit Pacific Medical Center, let's talk a little bit about what we're doing. And I mentioned specifically about our wellness center, just absolutely beautiful building that I'm blessed to work in throughout the week. And I remember talking to one of our physician leaders, and she said, when I looked at that building at first, I was like, wow, that is really a big building. Is it worth the investment? And she realized a couple of things. Number one, obviously, we utilize that space incredibly well, and looking forward to, with the pandemic resolving, being able to open up even more and more to the public for public use as well. But to us, it's really making a statement that the wellness of our community, the health of our community, is incredibly important at Summit Pacific. One of the things that we're going to do, and this is partnering with Choice, as well as many, many other community healthcare organizations across about a 5-county area, is to bring Blue Zones into the community in the upcoming years. So a little background about Blue Zones. The gentleman, Dan Buettner, who is a journalist and has done some other things in his life, he did some research and he realized that there's pockets of communities in the world, and you can see a few of them: Sardinia, Italy, Loma Linda, California, Okinawa, Japan, as amongst others in the world, where people tend to live much longer. So average age well into the 80s, as well as many people who live well past 100 and live well past 100, very healthy type of lives that I think most of us would want to continue. And what he found was really that there were certain common themes across each of those communities. First, people move naturally, meaning people walk, they hike, and that's just a normal part of their life, right? And so it makes exercise easily because that's a normal part of their life. They're part of what he calls the right tribe, but that's where the people are in a community, and the community supports itself. There's care for each other. And in fact, in many of those communities, there's a common religious, and I'm not here to proselytize about religion today, but there's a common spiritual belief amongst those people where people feel supported. On top of it, they eat wisely. They tend to eat more what we call a Mediterranean diet, so low in saturated fats, have more healthy fats, and then a lot really heavily vegetable and fruit-based compared to fatty foods. And then people have the right outlook, meaning they support each other, they remain active, and so lower influences of depression and other such things as well. And people in communities like that tend to live longer. And so we're going to participate in what's called a Blue Zones Activate to really understand and then to begin to be able to invest in what will make this community closer and closer to a Blue Zones community. Part of what we want to do is have partners, and this includes insurance companies, so what we call payers and an insurance company, who understand the importance of keeping people well and then are willing to invest in our community. So we're looking for partners, and we have actually found a couple I'll talk a little bit more about in a moment that will allow us to begin to transition from fee-for-service, which I mentioned, where you basically paid to provide more procedures, more activity, as opposed to pay for value. We want to focus on keeping people well. That's the most important thing too. And so we're looking for partners to be able to do that. Really transition from what we call sick care versus keeping people well. Not saying that you ignore and you continue to take care of sick people, but how do we avoid many, many, many of the patients that we're blessed to serve from being sick? How to create sustainable healthcare. With our current spend, nearly $13,000 per person a year, it's not sustainable in the United States. How do we make it sustainable so people get excellent care, and not just for this generation, but for every generation to come? And then actually, we want to take risk. We want to put our pencil to paper and say, we're going to actually make people healthier. And by doing so, we're willing to take risk and actually put some of our payment on the line that we can make people healthy and avoid ever being sick. So we partnered with two different companies. One of them is a Medicaid company called Amerigroup, and the other one is an ACO. So this is a Medicare population, and our partner there is Northwest Momentum. With these insurance companies, we're really emphasizing quality. For instance, in Amerigroup, really focusing on diabetic care, vaccinations for children, getting wellness visits in for both children and then our ACO partner in terms of getting adults, Medicare population in for their annual Medicare wellness visit, which is just so critical. We'll talk more about that in a little bit as well. Providing care coordination services. Somebody's been in the hospital. Well, they're very vulnerable to get readmitted again or get sicker. Right now we have a RN care coordinator, Skylar, just a phenomenal job, just reaching out to individuals and understanding what their needs are, how we can further equip and get them back into a community program that might be able to keep them healthy, and how can we avoid readmission to the hospital. And then obviously looking at affordability, sustainable healthcare for our community. So great news that I mentioned, more patients than ever are getting wellness visit here. Wellness visit, people used to be called their yearly physical, but basically it's where you come in on a preventative basis, at least yearly, and you talk about early opportunities to diagnose conditions such as diabetes and hypertension. And one, to make sure that they're always controlled. And then two, in fact, sometimes with those conditions, if people make lifestyle modifications, they can actually be resolved. And somebody who's been diabetic is no longer diabetic, or somebody who's been on medications for hypertension, they make some lifestyle changes, maybe lose some weight, get some exercise, change their diet, and so they don't need those medications again. Talk about recommended vaccinations, cancer screenings, other such things as well. Make sure people have had a colonoscopy if necessary, mammograms for those women who would benefit from one based on age as well as risk factors. Well, the great news is that we're significantly increasing people coming in to Summit Pacific, and phenomenal. We actually went from a little less than half of our patients receiving wellness visits in 2021 to almost 62% in 2022. So well over 7,000 people received wellness visits at Summit Pacific. So if you do need one, here's the number below, 360-346-2222, 360-346-2222. Please call, get in. We want to keep you well. So other things, obviously, part of keeping you well, part of being able to do wellness visits is access to health services. And we are aggressively trying to grow our primary care team. We actually have two current ARNPs who are doing fellowships, or just starting fellowships with us. We've developed a residency program with leadership of Dr. Sean Andrews, Dr. Dietrich, as well as many others to train providers who then will hopefully stay in the community. Adding other providers as well. Another primary care provider will be starting with us soon on top of that. Later this year, we're going to actually have a low barrier primary care clinic. And the idea is to really be able to treat people when they need to be seen. In particular, maybe vulnerable people who might be homeless or struggling with addictions and other such things. We know there are very short windows when people are willing to access healthcare. And so we want to be able to be available when those windows are, to make sure that we could best intervene to best serve the community. Part of that is behavioral health services as well. We've just hired a phenomenal psychiatric ARNP, a new counselor will be starting with us soon, and we're recruiting for more of those individuals. And I've actually have a partner who will be coming with it on board very soon, who will also be able to provide some virtual services for mental health and other such challenges. One of the big things that we realize is colon health is incredibly important. And so we've added gastroenterology services where we can perform colonoscopies, endoscopies, other such procedures. We're bringing in sleep services. You may not be aware, but people who have sleep apnea, and unfortunately it's very common in this country, are much more at risk for stroke, for vascular disease, which could cause amputation, for heart disease, and many, many other problems. And so we're bringing that into. And the next one I admit is a shameless plug. My specialty is physical medicine rehabilitation. And was really fortunate to join Summit in May. And part of my specialty, I focus on care of people with neurologic disabilities, so strokes, multiple sclerosis, spinal cord injury, on how we can enable people to move goal-oriented, getting them not just feeling better, but to be able to better perform the activities in life that they want to do. So a lot of stuff, and we're continuing to grow what we can provide to the community at Summit Pacific. So part of that then, in terms of creating the healthiest community in the nation, is growing our population health team. And we're actually actively hiring for several different people at this time. We're looking at trying to get a data analyst. We have a data scientist, but then we're going to be able to even further understand what's going on with the population we serve. A pediatric care coordinator to help that population. We're looking at hospital-based care coordinator and RN care coordinator, as well as a medical assistant care coordinator who will help with our Medicare wellness visits, and an outpatient RN care coordinator as well. All these individuals will really be able to focus in on assuring that our patients are aware of services, that they are aware of the care that they need, and prevent people from getting sick. So part of that is, as I mentioned before, is understanding what's going on with populations. And so we have an incredible data scientist who started with us last year, Brittany, and just doing a phenomenal job of really better understanding what's going on with our population. And if you think about it, we need actionable metrics on key preventive interventions. And we're really beginning to get ahead of that curve. And so we could understand, are we doing what we need in terms of diabetic care? Are people getting their hemoglobin A1Cs, which is a test of people's blood sugar over a period of time? Are we controlling their blood pressures to prevent strokes? Are women getting their mammograms? We're going to look more into colon health as well in this upcoming year, and many, many other metrics that we can follow. We're actually going to go through an electronic health record conversion later this month to what's called Epic. And Epic's really the gold standard of an electronic health record. And with that, there is a module we call Healthy Planet, which will make it even easier for us to assure that we're providing the right care to every single one of the patients that we serve. We're also looking at other ways to measure health. And then ultimately, we want to get to what's called block level data. And so what we know from the medical literature is, based on where people live, they're more likely to have challenges of the social determinants of health. They're more likely to have certain medical conditions. And so really understand what even our community at a micro level is going to likely occur, get ahead, and maybe might have specific challenges. This micro community might have specific challenges. Well, how can we reach out to those individuals to proactively promote wellness, prevent diabetes, heart disease, other such conditions before the majority of those people in that community may get them? So this is just an example of some data. I've washed a little bit out of it, just out of privacy. This is actually an Amerigroup population, but looks at type 1 and type 2 diabetes. And the question is, okay, have you checked your hemoglobin A1C, and is under 8, meaning it's pretty well controlled? And then also, if you looked at your blood pressure, and is that pretty well controlled? But now we could look at it per provider. We could even break it down to how many of these individuals may be homeless. And obviously, those people are significantly more at risk. Where do they live in terms of the patients that we serve? And then what languages do they speak? Meaning, maybe we want to do a diabetic education program, and we realize that a certain language or a certain individual people group may be at more risk. Well, we need then to have interpretive services, materials that are interpreted to that language to better assist that specific sub-community. So very cool stuff that we're doing in data. Innovation is incredibly important to us. In fact, one of the most fun things that I do with my job is our senior medical director of population health. And so, one of the things that we're doing, and we're partnering with the Mayor Group for, is called Summit Care 3.0. We actually did several Summit Care programs for our own Summit Pacific caregivers, our employees in the past. And really, it's a comprehensive wellness program, and it's designed around the individual, where the individual takes a huge part of designing the program, this health action plan. We're focusing this one on patients who are 52 years or older for the most part. And then generally they have significant medical conditions, diabetes, COPD, which is lung disease, often associated, but not always associated with tobacco use, and then heart conditions. Each individual meets and has an interdisciplinary team, including multiple subspecialties, nutrition, pharmacy. I take part as physical medicine rehabilitation, therapists, physical therapists, exercise physiologists, as well as others. And of course, the patient, or we like to call participant, him or herself, and the person's primary care provider. And based on that, we design a comprehensive health action plan. This is designed to go over the course of the year. We provide screenings, assessments, but then in addition, classes and education. Talk about how to create healthy habits and provide some resources about that. Check-ins and coachings. We have a patient coordinator who will follow up with these individuals monthly for encouragement. Some of people say, hey, I even need accountability. You follow up with me from there. And then also help with any behavioral health concerns, depression, because we know that if people aren't in the right state of mental wellness, then it's harder to take care of our physical wellness too. This is a really cool thing we have. We have a device now called TidalCare, and it provides really advanced level virtual services. And so we all know that virtual visits, telehealth, are becoming more and more common in healthcare. Well, the challenge historically has been, well, yes, I could talk to you on the telephone or the computer screen, and I could understand a lot of things, but I haven't been able to do as much physical exam. Well, the TidalCare device allows a provider to virtually examine a patient, and that includes obviously checking blood pressure, things to that extent, but being able to look into the ears, being able to listen to the hearts, look in their nose, look in their eyes to see if there's abnormalities there. And we're actually going to partner with Elma Elementary as part of our school-based program to see how well that works in serving that population. And then we're going to look to expand TidalCare to 4 or 5 other sites throughout 2023 and into 2024. FoodRx, an exciting program that we also are partnering with a Mayor Group for. And what this program does is really looks at food as medicine, because we know that food is one of the best ways healthy food to prevent obesity, or to help people who are obese to get to a healthier weight. We know that food contributes to diabetes. We know that food contributes to hypertension and many other health conditions. And so this program is available to people with a Mayor Group insurance whose BMI, or basically a measure of obesity, or they can be considered overweight, a BMI greater than 26. People who are at risk for diabetes, or maybe have diabetes based on that hemoglobin A1C I mentioned previously, or that they're at risk for high blood pressure, or potentially have high blood pressure. We're going to do this for about 100 patients. And what we're trying to do is to teach healthy lifestyles. And so part of that is we're going to have food courses, provide recipes, but then even provide some basics for meals. So specific food, chicken, fish, vegetables, those sorts of things that people can use to cook healthy meals, and really teach people how to change and develop that healthy lifestyle. Ultimately, we believe people need to catch that vision. And that starts internally, trying to inspire our providers and all of us as caregivers to promote healthy wellness for us, and then talk about that with our patients and with our community. Beginning to look at, well, changing how we're compensated, getting away from that fee for service and aligning us with value. And then obviously continuing to talk about the importance of population health, keeping our community healthy. And that includes talks like we're having today. So thank you for participating in that. So I'm just going to talk a little bit about just the ideal state of where we would like to get to go. And this talk, I'm going to use diabetes as a reference, but the reality is you could do this with numerous other health conditions. But we do know that diabetes is a significant problem in our community. In fact, we have a higher diabetic rate than our state's average specifically. And so we believe that if you're going to treat diabetes, it really needs to start in the community, meaning, do we have the correct infrastructure and support services? Is it easy for people to exercise? And in fact, one of the reasons we designed a campus that is open to the community, that has walking trails and splash pond and playground area, was because we wanted people to understand and develop that healthy lifestyle and make it easier, frankly, for people to do so. We want our community to understand wellness and collectively encourage it. So mention a church potluck, or it could be any potluck or organization's potluck. Do people understand the importance of healthy choices? Are they bringing vegetables and fruits and not just desserts or more fatty food? Can we make it easier for people to make wise choices? And part of that is really just education and understanding. And sometimes there's some easy tricks that we'll go over in a little bit that can just help. Obviously, bring in providers and care teams, but then in addition, give them actionable information, meaning the data, and make it easy for them to be able to use it. And so for the diabetes example, our patients that I may be caring with who have diabetes, is their hemoglobin A1C controlled? Is it time to get another one of those tests? Are they on the proper medications for prevention of stroke and for blood pressure control? Are we looking at those sorts of things? Are we following the appropriate care? Have they been referred to a nutritionist, if that was appropriate, as well as receive the education? But make it easier for us as providers that even before they come in, part of our care team has identified that the provider could talk about it with our patients who have diabetes and make better selections. And then also being able to identify people who are at risk for diabetes, right? And making that clear to our providers as well, so that those individuals can be prepared and will do preventive things before that even becomes a problem. Talked about compensation a little bit, and then really focusing on those patients who are at most risk. And then provide resources to help individuals and care teams succeed. And as I mentioned before, if someone struggles with some behavioral health or mental health concerns, are we helping those individuals so they can take other conditions they may have too? If I'm struggling with depression, I may not do a good job taking care of my diabetes. So let's help with the depression, and then I could better thrive with diabetes. Providing more and more care coordinators as well to assist. And then obviously, as we develop these programs, test them and making sure that we're getting the success as we invest in the community. Excuse me, I've been talking a lot. So here's a couple tips and tricks that you can use and your family can use to be healthier in 2023. A lot of this is what I'm going to talk about is from this really good book called Atomic Habits by James Clear. But there's a lot of other books that can give you similar advice. And so as we go into a new year, a lot of us make resolutions. I would argue create habits, not resolution. So a resolution often is a firm decision. It's often to do big or potentially even not do something. Goal directed. Nothing wrong with having goals. But sometimes we make such large goals, it's very difficult for us to achieve. And when that occurs, we stop. So they're based on hope and resolve to compare to a habit, which becomes easy because it's an ingrained behavior. So a habit is a routine or behavior that's performed regularly, and in many cases, quite honestly, automatically. You don't have to think about it. whatsoever, because it becomes a part of you, it becomes a part of your identity. And what this automaticity does is decreases my brain's demand. I mean, I could be thinking about other things because this is now a habit. And so habits we do naturally and easy as compared to resolution, which is hard specifically. So how do we create habits? The first is focusing on tiny, gradual strides to the behavior we want to develop. Your goal may be to do something really big, but what are those steps that are going to get you to the journey? Focus on those first. So small behavioral improvements, which then can be stacked together. I'm going to talk about some examples of that in a moment. And then make it easier. Human behavior follows the law of least effort. So we naturally do the easier thing, or in fact, we avoid the harder thing. So that's, like I mentioned, the reverse is also true. If it's harder to make unhealthy choices, so if you make things that maybe you've done something, maybe you smoke tobacco and you decide, you know what, I'm going to get rid of the cigarettes from my house, well, it's harder to smoke, right? As opposed to, unfortunately, your spouse smokes as well, and that person has cigarettes. Well, it's going to make it much easier to smoke. So making it harder to do an unhealthy habit, you're more likely to break it. So here's a couple examples. So let's say part of my New Year's resolution is to lose 20 pounds in New Year's. Don't focus on losing the 20 pounds, but make it easier to lose weight. So here's a couple of things you can do. One thing we know is that if we go to the grocery store hungry, we're likely to spend more. We're likely to more pick the cookies or things to that extent. So if you're hungry, don't go to the grocery store. In fact, people spend about 1.5 times more and are in the grocery store much longer as well if you're hungry. Consider curbside pickup. And I don't think a year ago I'd have even thought about it. But what it does is it decreases impulse purchases. You're not there seeing the new cookie flavors or whatever it may be. And so you just order the healthy food and avoid that temptation. Frankly, it saves time as well. Here's something that gets a lot of people. And one way to avoid it is pay at the pump. So for instance, and you may not have known this, gas stations make most of their profits from snacks and the sale of alcohol. And so if your natural inclination is to go in and buy a candy bar or a soda or something to that extent whenever you stop at the gas station, well, don't go in. You're going to avoid that temptation and just pay at the pump instead. Here's a couple of easy ways to lose weight that I tell to most of my patients who would like to lose a few pounds. Sugary beverages are a quick way that adds calories and actually doesn't even make us full. You know, things like energy drinks, obviously sodas, but coffee drinks, Starbucks, those type of things have a lot of calories. And then fruit juice actually has a fair amount of calories as well. And in just a can of soda, so that's 12 ounces, generally it's about 140 to 150 calories. So if you drink a can of soda a day and you completely cut that out, you'd lose about 15 pounds in a year, relatively easy. And here's the other thing that a lot of people don't realize. A can of soda is about 12 ounces, right? Well, if you go to a fast food restaurant and they give you a soda, often that's 32, even 40 ounces. And so you got to multiply that. You'd have almost 500 calories in just one drink. So try to avoid that wherever you can. Also avoid adding unnecessary fats and calories to your foods. You may not realize that, but 2 tablespoons of ranch dressing doesn't seem that much, but there's well over 100 calories. In fact, it's almost as much as a can of soda and just 2 tablespoons of ranch dressing. So if you could decrease the amounts of butters, dressings, things like that you add to your food, once again, it's an easy way that most people don't notice to shave off a few calories and then ultimately a few pounds. One of the things that we naturally do as people is if you have a plate or you have a bowl, you fill it up. I know what I use is the ice cream analogy. If I get a bowl of ice cream, I don't just get a little bowl of ice cream, I fill up the whole bowl. But if I start with a smaller bowl and I fill it up, I'm not going to eat as much ice cream. Also, by choosing smaller plates, what happens is you eat what's on your smaller plate first, By that point, your body may have a natural tendency. Your stomach says, you know what, I'm full. And so you're likely to stop sooner. And the other thing is, if you are going to a party where people bring food, make it easy for not just yourself, but for everybody else. We're bringing a vegetable tray or some healthy option instead. And then when you start filling your plate at that potluck, make sure you put the healthy stuff on first. You do a couple things. One, you ensure you eat at least some healthy food. And then two, you filled your plate at least partially with something healthy, which leaves less room for the unhealthy options. So let's talk about a goal of maybe how I could begin to develop habits. And let's say I'm a couch potato and I spend most of my time on the sofa, watching television, snacking, those sorts of things. But I decided, and this is a great activity, Summit Pacific's 5K walk or run, and I want to do that. And that's one of my goals come September of this year. But I'm starting really from scratch. Well, don't focus on the fact that, hey, I want to walk or I want to jog 5 kilometers. Focus instead on creating a habit of walking. So one great way to create a habit is first to verbalize it, meaning when you say something, there is more power. Psychology is you're more likely to continue with it. And then maybe stack it on another habit. So the idea of stacking is there's habits that I already do. And so, for instance, I eat dinner every evening. Well, I'm going to decide that after dinner, I'm going to walk for 10 minutes a day. And then that way, my habit of eating dinner naturally flows to the new habit I'm creating of walking for 10 minutes a day. And then I verbalize it. You know, I will walk for 10 minutes after I eat dinner each night. Great if I can have accountability, meaning I'm going to do that for my wife, and she agrees. And then the nights I don't feel like it, well, she's going to say, hey, you know, Kevin, we better go do our walking. Then I want to make it easier to do the right thing. So I put my tennis shoes by the table. And that's one, a reminder. And two, it's easy for me to get my tennis shoes on. And then in addition, I could set an alarm. That's again, making it easier, get that reminder where maybe you take Alexa, put, provide an alarm, and Alexa could even say that, or you could use other things, calendar, where you cross it off on the calendar once you do it, those sorts of things. So I've established my routine. Here's the reality. Sometimes we have bad days. Sometimes life happens and I may miss a day. Well, the key of creating a habit then is really avoid that second miss, because otherwise you could create a habit now where you are no longer walking. So avoid that second consecutive day of missing. And then realize that some exercise or some of doing the right thing is always better than none. You know, a lot of times I've heard people say, well, I don't have a full hour. I like to work out for an hour and I don't have a full hour, so I didn't work out. Well, the reality is, even if it's only 5 minutes of working out or 20 minutes of working out, it's still better than none. So continue anyways, and pat yourself on the back for what you've done. Then you could stack further habits. I'm going to do some stretching afterwards, or I'm going to increase to 20 minutes, or I'm going to jog for 5 minutes and then I'm going to walk for 5 minutes, something to that extent. And then ultimately, as we create these habits, we begin to change our identity from being that couch potato to being somebody who cares about fitness. Well, I really appreciate you taking the time to listen, and please shoot me some questions. I'll put my email in a second. So what we talked about today, first of all, talked about some of the challenges that we have in this nation in our healthcare system, the significant spend that we have, almost $13,000 per person by country in the world. And unfortunately, if you look at life expectancy and some other healthcare outcomes, we're not the best despite the amount of care we spend. So we need to change that model. And that's what we're trying to do with population health. We want a better understanding with the population health program. We want to develop a better understanding of the risk factors of how well we're doing on multiple health measures, and ultimately use that information to design programs to focus care on the individual and the community as a whole, as we work towards our audacious vision of creating the healthiest nation in the United States. Excuse me. We're investing in our community to get to that vision as well. both with individuals bringing in more primary care access, as well as other specialties to assist with our wellness journey. But then in addition, a population health team, we're continuing to grow so that way we could provide the best care possible. We're using technology and developing novel programs along this journey as well. And then ultimately, as an individual, I could develop habits and encourage each and every one of you to do so to become even healthier in 2023. Well, once again, I just appreciate your time in listening to this talk. Reach out to me if you have any questions. And then once again, please continue to look forward to our future presentations in our 2023 Community Education Series, which will really focus in on navigating our healthcare system. So thank you for your time, and I hope you have a wonderful and healthy 2023.